Hi, my name is Dr. Masoud Saman. I'm a facial plastic surgeon in New York City. And today I want to talk to you guys about the top 5 things that don't go with my aesthetics. Every surgeon's aesthetic is different, and that's kind of from their soul. That's not learned. And if it is, then it's too forced. The personal aesthetics of a surgeon should come from what they like and their dislikes. So you see that different artists will have different outcomes if you give them the same paint, same brush, and the same topic to paint on the same canvas. Same thing is true of rhinoplasty surgeons. We all have slightly different aesthetics. So today I want to talk to you about my aesthetics, the top 5 things that I cannot tolerate. Number 1 is going to be a nose that's too scooped. Too scooped or over resection of the dorsum causes an infantile look. I don't like it. I don't think it's pretty. It's not attractive. It reminds me of Cindy Lou and Whoville, if you remember that movie, and it's for no one. 2, a tip that's too upturned. Tip that's too upturned. If they can see through your nostrils, that's not good. Generally, if you look at the angle that's formed by the base of the nose, called the columella, and the upper lip, I like it to be somewhere around 95 to 100. Some people like it a little bit more, but I like it around there, but never all the way up like this. In fact, in the older techniques of rhinoplasty, which is still commonly used, the tip is set all the way up, and then we count on scar contracture and time to allow it to drop. With the technique that I use, this tip is set exactly where it is and where it's gonna be 20 years from now, 30 years from now. So I don't like unpredictability. I don't like lack of control. I like to know exactly where the tip is gonna be and where it's gonna stay. A tip that's too pinched. The nasal tip is made up of cartilages. Whenever you cut something out in the body, that's replaced by scar tissue. So this is true in the nose as well. If you cut too much away from the cartilages of the nose, you create pinching, scarring, contracture, not pretty and not functional. Same thing up here in the front. If you cut away too much, you make it too narrow, it might look really pretty immediately after surgery, but over time it starts to look warped, does not look good. Every little angle and every little contour will show, and it's not a good look. Take us to number 4, breathing. Okay, this is not the aesthetics, but to me, and you know, as a wise man once said, a nose that's pretty is a nose that breathes well, and a nose that breathes well is a nose that's pretty. As an ENT trained surgeon, I just can't help it. The breathing has to be there. I have to look inside. If there's a problem with the septum, the turbinates, any of these things, I have to fix those things. So breathing is super, super important and needs to be maintained or improved. Finally, the effacement of the nasofrontal angle. So the nasofrontal angle, if you look at the side profile, generally it has to come in, dip, and then take back up. And sometimes we elevate this area called the radix augmentation so much that this becomes just one line. If you look at some results, you'll see that, and that's not pretty. So there you have it. 5 things I don't like.